to do. We didn't do anything that we extraordinary, but what we are saying is that we covered a lot. And within less than 2 years, we covered quite a lot. We know we have our shortcomings, and these are some of the areas, and that's why you are called us here, that we are trying to address. Having said that, it's good that the FIF actually was mentioned, and I would wish to bring to the attention, I think it's just the House and my chair is actually here. I would wish to humbly appeal the FIF bill to be passed. And this is in the interest of the people. I'm very sure you understand what that means. I do not want to go into details. It is in the interest of the people, and some of the resources that sometimes we go through bureaucracies and processes, and a lot of people to access that money, and the help money is not in advance, will not go through. I mean, we have really improved in terms of our revenue collection. In some facilities, like for example, IFTI, that was collected about 20,000 a month, 30,000 a month. IFTI Sub-County Hospital was collected 30,000 a month. Today we are talking about 600,000. So, I mean, we have done quite a lot. Modogashe was actually collected. The last time that we sent, there was a team that actually was doing an RI, and was having a dialogue led by one of our head of our department. And at that time, I think Modogashe was collecting at 1,000, 15. And right now, Modogashe, I think should have 300 or 400. Yeah. So, I mean, we have covered quite some ground. I'm sure you know why I'm going to all these details, and why I really want the FIF bill to be passed so that we do not have some of these hiccups that we are having. There's a lot that we have done. On the issue of cancer that was actually asked as a follow-up question, and by also Honorable Hassan, actually it is, we met with the CEO last week, when we were discussing these drugs that have just reached us and which are being distributed. And cancer actually, also with the help of the national government, is trying its level best to have a fill rate of over 90%. You know, it depends on the kind of drugs that are actually also sometimes prevalent, and they use more in some areas. And so in some areas like Western, what they told me is that they are already at 85%. So what they have promised us that they are working towards that. They are our partners, we give them the benefit of doubt, and I know under the leadership of my former colleague, was himself a CEC, is a lot that has actually changed. But having said that, the last procurement that we ordered, the last one that has just been delivered, we got about 50% for Garissa County Referral Hospital and 75%. On MERS, we had a meeting with the management, the CEO, the senior management. We had their debt, some money, and we actually cleared. So we wanted to start with them on a clean slate, because what happened is that there was some money that we owed them for quite a long time, and the matter was actually going to court, and this was actually something that had actually also come from previous administration, and we have settled that out of court, and everything is okay now. It's something that we are working on, and because of that, of course, when that history comes, there are things that are supposed to be streamlined here and there. But we have the MOU draft, we have gone through it, we have sent back to them, and they want to go into an MOU. Once we go into an MOU, I'm very sure there will be seamless supply of drugs. Having said that, again, in terms of the drugs that we used to procure, initially the drugs, of course, normally supposed to last us for about 3 to 4 months. But then one thing that has actually happened, and which you will see from the report that we sent you, our workload has increased. The demand for the services at public hospitals has really gone up. And the facilities that are actually operating very well. I'm not talking about the ones, of course, that are not operating. It should not be quoted wrong on that note. And you will realize that now also on our part, we have to change on our procurement of drugs, and how the forecasting and the quantification is done by the cost pharmacy department and all that. Thank you. If there is anything that I missed, I think it will be answered. But on the HR is the question that is remaining, and it came again and again. Let Ali, my colleague, please answer that.
Chair, maybe before the CCDs of the issue of the drugs. CC, we have, through the chair, we have very reliable information that there are a lot of drugs that are expiring in your stores. The main store that supplies here, PTH. So why should at this time such a thing happen when we are having serious shortage of drugs? Why should a number of very important drugs information, and we are getting very valuable? Why should that happen? Chair, do you?
Let the director maybe answer that, please.
Okay, thank you very much. Actually, the drug, yes, there's an expired drug in our store. But remember, this is not a drug. Some of these drugs that we are purchasing, maybe 6 months to expire, some of them. So, and maybe some of the health facility, particularly the rural health facility, the usage, the workload is very low. So in that, drug may expire for one reason or the other. But what we have is not that whatever is being brought is expiring. That's not the issue. The issue is, as a county, we don't have an incinerator to dispose of drug which expire for one reason or the other. As a county, here. So normally what we do is, we transport this drug from here to either to Malindi or Embu. So because of that, and it is very costly, you have to hire lorries, and you have a lot of logistical involvement. You have to go across the county and do this. So we just put it in a certain place. When it accumulates, then we just do at once and transport it to that place. That's actually which is bringing the issue of expired, not only the expired drug alone, but even there's some commodities in cancer and other places and other health facilities which cannot be disposed of in our current incinerators that we have. And but I wish to report that at least we got a support to construct a modern incinerator, which work is beginning very soon through the national MOH at the county referral hospital. So that once that is done, everything that the challenges that we have had will be addressed. So that is the point. The other thing, the members I want to take note is drug are ordered on quarterly basis. We are not making drug order on monthly basis. We are ordering drug on quarterly basis. Meaning the last supply we got was October last year. And the second order that we were supposed to make was February. 1st of February we were supposed to make. There was a delay because of issue of finance and many other factors because that are involved. So, and the other issues I want also the members to understand is drugs are not, it is not a push to the facility. It is what the facility in charge in that facility order, what they need. The drug that's not available, they need to quantify and say using their monthly workload as a facility. If this facility is seeing maybe 100 patients which have pneumonia, then they need to quantify how many antibiotics of different categories do they need for that sample. Yes, for those formula. So this is it. And the major hiccup that was coming, the issue of drug shortage was that not that we are not ordering, it was because of the fill rates from the cancer. Once we address the fill rate of the cancer goes up, as it has done already in the most of the parameters, and we complement the rest through meds, I think the issue of drug is addressed holistically. Then the other issue we want you to understand is the cost is actually increasing. If I give you an example, Garissa County Referral Hospital in 2018, we used to order 10 million on quarterly basis. But today, we are ordering 45 to 50 million on quarterly basis. Why? We never had an ICU up and running during that time. We never had renal unit up and running during that time. We never had a radiology department up and running during that time, and ICU. And this are some of the units which are high consumers in terms of the health commodity. Because one patient for one session to be dialysis, they consume 4,000 shillings for that one, for one session. And this maybe a patient that may require maybe 7 or more sessions in a week. So now you can anticipate the cost involved in that aspect. So the issue is, we also request the members of this house, when you're looking at health budget, for us to provide drugs holistically and optimally across our health facility, it must have appropriate financing to the department. We cannot take the responsibility of non-supply if you don't have the adequate amount allocated to the department. If you look currently, what we proposed was that for the Garissa County Referral Hospital to have optimal supply, the whole year it must be allocated 200 million. And the rural health facility to get 300 million. That totals 500 million Kenya shilling for optimal drug supply across the board. Then, if that is not done, it's not our fault. Because you don't expect the department to look at somewhere else. There's nowhere else, and this is the house that appropriates budgets in this country. So when you are appropriating budget, we need you to look at it critically when it comes to drug supplies, when it comes to HRH. So there was issue of staff development. We can only go on that if we have better allocations for human resource for health, which is the cornerstone in terms of addressing the issue of motivation, staff development, and everything. So promotion cannot happen if the budget is not addressed. Recruitment will not happen if the budget is not addressing. So for us to come here and say this and this, we're cheating ourselves. Let us see what is it that for health to function, what do we need? And unfortunately, and I want you to take this, health was evolved without doing costing. It was not done costing. You need to do what does it cost for a county government to run and deliver healthcare services. That cost has never been done. It was just bush to the county. If that would have been done, and we understand these are the costs, then we could have not have a problem. Here we are told there's a wage bill. If you employ a specialist and you deploy them, that's a development. But you're told, no, it's a recurrent. So these are the things. You cannot build a health facility and forget to employ healthcare workers. Because the health facility will become an empty check at the end of the day. So these are the issues that we need the members also to look at in the broader perspective. Thank you.
Thank you, Madam. Yeah, sorry, there's one question we didn't answer, but just to follow up on that, the same thing that I was actually mentioning was that in terms of helping our individual consumer, this is now becoming a national concern. Because if we take care of all the needs, then it means now all the budget for the country maybe will as well even go to health. And that's why there is a demand now that the national government increases, and this is the discussion that I told you earlier almost started today, that the national government increases the allocation for the counties for the counties on the basis of health. And there's even one reason why that will happen. For instance, we send doctors on study. Those doctors that we send on study provide HR services to the national government. And for example, they're studying in Nyata and Moi during their specialization. So what we have always been telling them is that they are on paid study leave, let the national government pay them. And this is some of the things that the national government was actually never wanted that. And as advocates also and political leaders, these are some of the things that we also need to seriously push for. It was a good idea to develop health, but now it's even time to actually look for more resources for the health department from the national government. Otherwise, we cannot even promote the health workers right now because of the challenges that we have with already the wage bill.
Thank you, Wanazir. I think Wanazir has covered the issue of HR. I'm supported Honorable members, as you are aware, today afternoon we have a session. I will now rule that we limit our follow-up questions, please. We have a session afternoon, and due to the time, we will not take it. Now we go to the motion. The mover of the motion is around.
Chair,
Please order, please. Please order, please.
Please, Chair.
No.
There is one thing that has not been
Understand what we are now, please.
One thing that has not been done.
We'll give it the move of the motion. Question 1, please. Question 1, please.
Chair.
We go to the motion of the president.
Be gender sensitive. Allow me.
Chair, gender. Chair, gender, please. Please. What?
No.
It will not even
No, I would have to know.
It will not even take
No. Please order. Let's give mic to the. Let's in order, please. Give order to the. Give mic to the mover of the motion. Question 1, please.
Please respect the chair.
Chair,
There's a question that I provided to you.
Can you
Question,
please?
please.
Yeah.
There's no follow-up question as per now.
What about the issue of that, please?
Chair, there's a challenge we have in our different wards. And I would like us to make a request to the CEC. There's a general freeze on construction of new dispensaries. A letter was written by the CS to all donors, including Dr. Lee, freezing all new dispensaries. That's becoming a very big challenge. I will request that the CEC confirms to this house that that letter will be recorded so that we can have this new construction. My motion was upgrading of Alukune and Mato dispensaries. So I will like to request the CEC to confirm. I know we have been in communication with him, but we like him to confirm. This will not have any financial implications as such, but it will help in getting better services and also getting support from donors. Like Kenya Red Cross, they're ready to help us in upgrading the facility. Right now, the facilities have everything that is required to upgrade them from a dispensary to a health center. Thank you.
For more clarifications, no members. If you see, I'll give you. If you see the motions of the dispensaries, most of them the CSC have answered. If you go to question 2, that's been answered.
Not yet.
Not yet.
That is bending, that's why we
Bending.
need the question, Chair, please.
It's very exactly.
Not yet.
Okay, question 2. May you read it, please?
I'll give you. To the chairperson, I think chairman is a custom, is a president of parliament when a leader raises his hand to give them stay. Number one. Number two, this is a constitutional committee on Article 195, which has the same powers as High Court. Please give them time to ask and ventilate questions as long as they are very correct. And don't worry about the house, we just came from House Business Committee. We can stay here up to the whole night, so don't worry about it. Thank you.
Go for press.
Question 2.
Thank you, Manager. Manager, through you to the Waziri, have you deployed adequate health personnel to the public health facilities in the same ward? Yes.
I think, honorable members, most of you have came late. And the motion on dispensaries was what we have started early in the morning. The CSC has answered all of them. Unless you have follow-up questions on matters of dispensaries.
Yes.
He has answered.
Yes.
Okay? Honorable members, I want to give first question and more follow-up questions if you have it. Let's exhaust follow-up questions. And then we go to the motion on the spread of vessels. Question 1 has been taken. Follow-up question, please. If you see it, yes, you can note it. Follow-up questions from here. You have a follow-up question? Yes. Go ahead.
I think most of the time we have talking. Excuse please. Let's be. Most of the time we have been talking of KEMSA, and maybe facilities. We have satellite centers across the world. That does not has no facilities. But it's supported by the department through what we call outreach. In that case, in the outreach program, in most of the health facilities, we have only nurses on ground. While we were supposed to be having integrated services. What is your take on this?
I think I have also said here, follow-up questions, okay? Question Hamdi? Follow-up question?
Yes. Thank you, Honorable Chair. We have been talking about the ambulances, about the KEMSA, about the medical supplies, but there is one burning thing that we have not covered about the motivation of the staffs. And we expect the healthcare givers to give quality health service, quality health care. That is what you call. So during our visit to Garissa PGH, we have noted that the healthcare givers, such as the doctors and the nurses, have no medical cover. And the other thing, there was stagnation of the job groups. They have not been promoted for the last 5 to 6 years. And we expect them to give quality services to the people of Garissa. As a department, what are you doing to ensure that they get their right so that they give quality care to the people? Thank you.
Chair, my question I've already asked. I think I only need answers from the director.
Can you remind it?
My question was typically concerning, in question 2, we say, what are some of the strategies measures to address staff shortage? Then I didn't have that one. That's why I just wanted to expand to get maybe a concrete answer from the.
When we take a follow-up question, I will just follow all of you.
Just a follow-up question through the chair. On the issue of the question was asking a strategic placement of the staffing, strategic measures to address staff shortage. I remember there were 3 staff audits conducted, specifically, if I'm not wrong, for the health personnel. The last one some 3 months ago. This one does not call for employment of new staffing. It's to redeploy and see whether some extra staffing can be taken to other facilities, just like the way you have posted consultants and surgeons to sub-county hospitals. Bwana Waziri, through the chair, I feel that your office at the county has more staffing than even some of the sub-county health facilities. There are more managerial positions and staffing under the county health management team and also the hospital management team that can be utilized to be first-line primary responders in some of the health facilities than being idle in the offices. Thank you.
My question is broadly, I want to ask the CEC, there is some incident happening in Garissa Hospital, which we had through a rumor. And is that incident true? Because it has happened in the theater, which we had something happen very funny.
Thank you.
So just let me continue. I have the chair. Let me
us, because the Waziri is here, we cannot call all the time Waziri to appear in the committee. This is the only chance. So I am asking, bro, if he have any idea of that, he can as well give the information, because the circulation information which is happening in the town and we're hearing honorable leaders. So it is better he give us clearance on that. Secondly, there is an operation happened in Garissa and Jetta, which a mother was operated. Finally, we heard the mother was transferred to Capital Health in Nairobi, and the same mother passed. So what is happening in the theater? Is there something which we don't know is happening? Because there was some operation which is done in the theater, and the same person is being transported to Father's Referral Hospital, and in a short period, the same person passed away. So we need also to have what is happening in the theater. Is it lack of experience, what's happening in the doctors, or what is happening? We need actually a broad thing, that information.
Yeah. Honourable members, these are final questions. These are final questions. We have wind up our today's session. I will give you Chair.
Chair, we have a general statement, please.
We have only three members to ask for. Chair.
Okay,
please.
thank you, Chair.
No, the final question.
I think before the follow-up, Chair, there is a ruling that you made. The ruling that you made regarding the visit to Garissa Referral Hospital and the information Honorable has raised. I think those are issues that with the Committee of Health and the chairs with us here. That has already been ruled. You are not with us, Honorable. Mine is a follow-up on the staff shortages at dispensaries, health centers, and sub-county hospitals. This matter has been partly answered. What we want from the CEC is the efforts that you have done to reduce the shortage. Any reports that you have shared with the county secretary and also with the public service, Garissa Public Service, Garissa County Public Service regarding the shortage, the gaps on the staff. If those reports you have shared with them, when, because as an office also have a duty to make a follow-up and to call and also to make a follow-up with both the county public service and also the county secretary. If those reports are there, kindly share with the committee. And lastly, the issue which was raised by Honorable Hamdi on the staff promotions, healthcare, insurance cover, allowances, including uniform allowance and leave allowances, because there are reports from the staff that they are not getting all these allowances and promotions.
Okay, Chair. I will rule this please before I give to CSA. Anything, questions regarding to the staff motivations and